Hi everyone, my name is Pranati and I work as an associate of Belong Research Collective, and I welcome you all to the inaugural edition of the xSDG UnConference, which is an initiative of Belong. We're really happy to have you all here with us. A little bit about Belong for more context. Belong is a social innovation platform that seeks to offer discrimination-free services to people who are otherwise marginalized on the basis of their identities, such as caste, gender, ethnicity, disability, etc. And essentially, we run programs for three major verticals: the Research Collective, of which this UnConference is a part of, our Mental Health Collective, and the Literature Collective. You can learn more about these on www.belong.net. I'll be sharing the link for this in the chat box as well. Like I said, we're really thankful that you all have joined this specific session at the UnConference. The UnConference is actually a part of one of our most major initiatives at Belong at the moment, which is called the xSDG, in which X stands for intersectionality. xSDG essentially is a global platform to promote truly intersectional and inclusive development. And at xSDG, we've been curating resources in terms of research papers, reports, data sets that are not just focused on development, but also see it through the lens of intersectional identities that exist. You can check these out at www.xsdg.dev. We also have plans to host some podcasts around such themes, especially around topics as interesting as the one that we're discussing right now. And we're hoping to create a space for people to join this platform in the near future. The UnConference is actually being held in collaboration with organizations such as Dalberg, Breakthrough India, and of course, JPAL South Asia. And we've been very kind to have their full support throughout this initiative. A big shout out to them as well. The UnConference actually began on the 18th of August and is running up till the 31st of August. So we'd be really happy to have you for our future sessions as well. We have about 15 plus panels in total to understand how SDG programming and funding can better address the needs of those people who are facing prejudice due to their marginalized identities, due to a whole host of reasons, of course. The UnConference is featuring not just talk panels, but also interactive sessions, film screenings, workshops, etc., and is actually collaborating with leading thinkers, doers, funders, and development experts who are working across the range of SDG topics. If you wish to learn more about these different sessions or the schedule that we are following, I will shortly be putting a link in the chat box below. And should you have any questions about any of this, please feel free to write to us at www.xsdg@. I'm so sorry. Please feel free to write to us at xsdg@belong with the .net. I now hand it over to Tithee, who will be walking us through the details of our panel today and will moderate the discussion going forward. Tithee, over to you.
Thank you so much, Pranati. A very warm welcome to all of you, and thank you so much for joining us for this exciting discussion today. My name is Tithee Mukhopadhyay, and I am the Director of Research at JPAL South Asia. I will be moderating the discussion today, and as Pranati mentioned, we have been partnering with Belong over the last week for these exciting panel discussions, and I hope you were able to be a part of the other discussions that we had on inclusive SDG programming for fragile environments and gender mainstreaming. Today we have an extremely exciting panel on a topic that's very close to my heart. We are going to be looking at designing inclusive monitoring, evaluation, and learning systems for SDGs, where we will be discussing the approaches and challenges to achieving meaningful inclusion within the MEL systems. Before I move on to the panel introductions, I would like to share the objective and framework that we plan to follow for the discussion so that all the participants and speakers know what to expect out of the session. So the designing inclusive MEL systems for SDG, what we are going to be looking at is in a world of growing data inequity and measurement challenges that impede truly inclusive SDG initiatives and our ability to effectively measure the efficacy of our humanitarian and developmental effort, how should we be approaching this very large agenda from a systems as well as data perspective? So when we think about truly inclusive development, we find that intersectional identity markers are often overlooked in the planning design and the planning design and implementation of social programs that seek to improve the conditions of people experiencing poverty and distress. It is crucial to prioritize using systems and data in a way that serve the interests of those who face the greatest risk of marginalization and discrimination. To rise up to this challenge, approaches across the data value chain of the MEL systems need to be evaluated. And to do that, we have an excellent panel today. I can't think of better practitioners and researchers to come and find solutions and help the larger community think through these approaches in a far more systematic manner. Our goal today is to discuss the approaches and consider the challenges in this future-looking agenda. A little bit about how we are going to sort of structure the discussion. We will go through members speaking about their experience that actually speaks to this larger theme. We will delve a little deeper into very specific questions. We will have different speakers speak to each other on those questions. And at the end, we hope to leave about 15 to 20 minutes for Q&A, but we do invite you to drop in your questions in the chat window itself. So very quickly onto this amazing panel. Joining me today are Sarah Barr. Sarah is the Learning and Research Advisor for Crisis Anticipation and Financing at the START Network. Her work focuses on building the evidence base for early and forecast-based humanitarian programming. We have Naomi Falkenburg. Naomi is a monitoring, evaluation, and accountability and learning specialist who works with humanitarian and development actors to design, manage, and learn from their interventions to conduct insightful research and analysis. We also have Mehjabeen Jagmag. Mehjabeen is a senior consultant at Oxford Policy Management and leads OPM's global qualitative research community. Mehjabeen has over 10 years of experience leading evaluations, research, and learning studies in several countries in Asia and Africa. So we will kickstart this entire discussion with Sarah's turn. So Sarah, the most marginalized and excluded people in data are those who remain completely unknown, silent, and unheard. Finding and including these people requires different strategies across the value chain, the data value chain. You have recently overseen work to build accountability to affected populations within anticipatory humanitarian programs and piloted tools to bring an intersectional vulnerability angle into early action programming. So my first set of questions are for you. How have you been able to address this larger challenge? I mean, given that you already have some solutions in mind from this very, very recent experience that you've had. So how have you been able to think through addressing this larger challenge? And more broadly, how can we move forward from just disaggregated data? So very specifically, is disaggregated data enough to move the needle on meaningful inclusion?
Thanks for the great introduction, and very nice to meet the rest of the panelists. I mean, it's a great question. So as you mentioned, the work that I do at the START Network, which is a network of over 50 NGOs, working globally to try to improve the way that humanitarian programs are delivered. But we do a lot of work on early and forecast-based humanitarian work, which is kind of my wheelhouse. And I've specifically been working on monitoring and evaluation and impact assessment. In terms of inclusion, I mean, yeah, I think we've been working very specifically this year on trying to move beyond sort of large quantitative disaggregated data sets. So what we were seeing in evaluation data coming out of programs that we'd implemented was that we can see that people with different intersecting vulnerabilities or characteristics access and interpret climate risk information differently, which is what we're interested in: floods, droughts, heat waves, etc. And that they have very different options in terms of how they might prepare for and respond to these crises. But at the same time, we were seeing that, you know, a data set that has men, women, people with disabilities, people who are internally displaced, etc., tells you very little about people who might be female and with a disability and displaced, etc. And it tells you even less about how those characteristics are going to impact the way that people can prepare for or respond to a crisis. So the work that we did this year was starting from a position of knowing that we had a little bit of a way to go, but not really quite knowing how to do it. And we decided to tackle the issue head on and use an approach which we've called missing voices. So we took 2 case studies looking at cyclones in the Philippines and riverbank erosion in Bangladesh. Both of those are environments that have quite a lot of data, you know, there are big data sets around. We definitely weren't starting from scratch. We didn't want to go out with big surveys and ignore what was available. So we started from the point of conducting literature reviews and then working with agencies at the front line, working in communities to basically look at who isn't showing up in that data and to identify specific kind of characteristics and individuals, which were quite different for the 2 case studies. And then try to conduct like individual interviews with those people. So we did maybe like 20 interviews in each place, and they gave us really rich insights. So for example, they showed us that vulnerability and capacity change all the time. We saw, for example, a pregnant woman or a woman who'd been pregnant in the Philippines during the last cyclone was saying that the things that she'd usually done to prepare for a cyclone, she couldn't do that time because she was pregnant, but so she was dealing with a different set of circumstances. Or in Bangladesh, able-bodied adolescent girls still struggling to evacuate ahead of riverbank erosion because they worry about safety and protection and being out of the house without their family members in an unpredictable environment. So those are like just kind of little examples of the nuances, but in terms of like the broader question which you asked about overall kind of, are we there? What can we do to move the needle? I think there is a bit more work to do on making sure that we have good quantitative data sets, and that is a foundation. I don't want to say that that's not important, because you can't, if you don't know the population that you're working with, or you're not disaggregating the outcomes of your programs in that basic way, then you can't do anything else. But I think what we saw from spending time getting really rich narratives from people with overlapping vulnerabilities or intersecting vulnerabilities is that there's so much nuance in the way that people will experience an issue or a crisis, and you can't get that from a spreadsheet. So I guess the first thing that I'd say is that like there's a lot of value in making sure that you speak to people on the ground, and then also that we need to be quite specific in the way that we're approaching this. So I think what we saw is that, in the countries where we were working, in the Philippines and Bangladesh, there were general gender analyses that at least told us on the gender side about gender dynamics and about how men and women are impacted differently by the crises that we were looking at, or not necessarily by the crises that we were looking at, but by the gender dynamics in the communities that we were interested in. But what we saw is that like, it's really, really specific how people in a certain group will be impacted by a specific hazard in a specific place. So these kinds of analyses, unfortunately, need to happen like for every single project. And then I guess the third thing that I'd say, which I think can really move the needle, especially on when we're looking at outcomes, is capturing people's agency. If there's monitoring and evaluation people, I'm guessing quite a few of the attendees here will be M&E folk, and you'll look at a log frame and it'll jump, or some sort of monitoring or results framework, and it'll jump from the number of items that have been distributed to some sort of outcome indicator. It might be a health indicator or a nutrition indicator, but are we capturing the decisions that people are making with the support that we're giving them, whatever that support might be? If you distribute food in a community, then some people might give it all to their oldest children or their youngest children, or they might save half and keep half and have half now. All of that is going to impact outcomes. And if we're not thinking about the way that individuals are making decisions and acknowledging their agency, then again, we'll miss some important information which can help us ultimately have better outcomes. So there's a few reflections from my side, but I'm very interested to hear what others have got to say.
I actually have a few follow-up questions for you, and then I'm going to hand it over to Naomi to get her thoughts on this. So I think I completely agree with you in terms of, using agency as one of the key things that you look for to try and understand, like within a cross group dynamics, as well as, you know, something as simple as distribution of household resources is a big thing, because that slowly and steadily is becoming something, even as small as a household unit. It's becoming one of the key things for one to look at when we look at intersection in the future as well. So I think this is, again, I mean, while you did speak to this a little bit when you started up, but I just wanted to like very, very specifically ask you, if you had to take a step back, and you've been working in this system for quite some time, you have seen, you know, different actors approach this you know, meaningful representation or intersectionality, you know, from different lenses, from different constraints angles. But for you personally, how far do you think are we from meaningful representation? And what do you think is impeding the progress? I'll move to the positive part of that agenda point a little later, but I just want to know, like, you know, how far are we from that particular point, and then what is impeding progress according to you?
Yeah, I mean, so I work in lots of different geographic contexts, and I do think that representation it varies a lot. I think there is more work to do. We work, you know, I work with humanitarian agencies, and there is a lot of appetite to have genuinely representative, fully inclusive programs. So I think there's like the sentiment is there, and you know, a lot of progress has been made on making sure that we at least have good quantitative data. But I think in terms of getting meaningful representation, in addition to the kind of data and analysis side, what I see from a kind of evidence perspective is that we sometimes struggle to join the dots between the data that we collect, our analysis, and then how that permeates through to project design and into the outcomes that we're monitoring. I think sometimes the efforts to improve inclusion are a little bit piecemeal, or people do different things at different points in the project cycle, which might be looked after by different members of staff. And I think what I would like to see is like a lot more logic in pulling programs together from the data and analysis into the action, contingency planning, the targeting, etc., and into the monitoring of outcomes. I see a lot of very beautiful vulnerability analyses with very nuanced information, and then what translates into programming is sometimes like the same program design that I've seen like 20 times before. So I think, yeah, there's still something more on like gathering good data, and then it's also joining up the dots between the different elements of programming. And in terms of impeding progress, I think that there's a couple of things. I think that gathering good quality, nuanced data about intersectional vulnerability from individuals is quite delicate. It's not the kind of thing that you can like just do a survey about and ask everybody and kind of solve it. So when we were doing the missing voices approach, for example, two of the things that we found, which I think could definitely be a barrier, are around the people that you're choosing to collect that data. We saw that it was really important to select data collection specialists who understand a bit about the hazards that they're discussing, and about the communities that they're working with, that have like a proper feeling of kind of empathy and understanding, so that they can gather information in a sensitive kind of manner. And then the other thing is more on a kind of like skills side. It takes quite a lot of skill to gather this information as well. It's not a case of, you know, asking 10 questions and then solving it. Semi-structured qualitative interviews require a certain comfort within grey areas, which I think that this work on inclusion is kind of all about. So yeah, I think there's something around sort of skills and the data collectors themselves. And then I think there's also something about the speed at which we sometimes end up developing programs, especially in the humanitarian sector. We are under serious time pressure. And I don't know how to solve that, but I think it definitely impacts our progress sometimes.
And if you were to think about, you know, two things that could, you know, accelerate the move towards true inclusion, what would you what would come to mind?
I think the first thing is definitely on like really acknowledging and understanding the agency of these people with intersecting vulnerabilities, and starting from the process of like what they think, what they do, what they plan, how they make decisions, and starting from there rather than starting from a perspective of like, oh, we'll give this or we'll do this. It's more like really appreciating that the people that we work with are decision makers, and starting from that perspective. So that's one. And then the second one, probably not surprising, is on the data side, and just making sure that we have that nice mixture of data.
Excellent. Thank you. Thank you so much. I'm going to circle back to you, but I think with what Sarah left us, I think, Naomi, I can jump right into what your thoughts would be. So Naomi, you believe that the most impactful interventions are evidence-driven, inclusive, and participatory. So the last two questions that I asked Sarah, I'm going to ask you the same questions, because I think your perspective is, I think your belief is going to be very similar, but your perspective and your experience might just be a little different from Sarah's. So I'll just repeat both the questions at the same time so that I don't pause in between to, cut you short and speak. So the first question is, how far do you think we are from meaningful representation of intersecting identities? And the second question is, what according to you is impeding this progress, and a couple of things that you can think of that can accelerate the move towards more inclusion?
Yeah, thank you so much, Tithee, for these really interesting questions. And it was a pleasure to hear Sarah's responses as well, because I think we're very aligned on a lot of things. In terms of how far we are when it comes to meaningful representation of intersecting identities, I would say quite far in my experience. Right, I see the term inclusion being used a lot in both the humanitarian and the development spheres. And while it always certainly sounds very good, it's not very clear often what it actually means and how a commitment to meaningful representation can actually be translated and reflected into MEL systems. I definitely agree with Sarah that it's much more than just disaggregating our data, even though that is an extremely important step. And one that is not even consistently done. For me, I think inclusion is something that can and should be mainstreamed at every stage of both the program and the MEL cycles, right? What Sarah referred to as connecting those dots. It's also something that we need to be extremely proactive about, right? We need to make sure that all groups, including those who are marginalized or vulnerable because of these intersecting identities, are not only visible, but we need to take steps to identify and reduce the barriers to their meaningful representation and participation. So I do think that there are some positive trends, but these are mainly when it comes to data collection and disaggregation. So for example, I would say that there's been much more of a focus, right, on gender and disability. We see that there's more targeted programs. In the case of women, there's also more consistent sort of gender mainstreaming in programs. And like Sarah also mentioned, gender analyses. When it comes to disability inclusion, we see a lot more targeted programs as well. There's also a few sort of positive trends in terms of like standards and guidelines, both in the humanitarian and the development spheres. So for example, there's the Sphere Handbook that sort of lays out some best practices, right, for data disaggregation, where they say, okay, as a minimum, let's try at least to disaggregate for sex, age, and disability. You have a few similar kinds of standards and guidelines for the development sphere. So I'm thinking specifically of like the interagency and expert group on sustainable development goal indicators. So, there is some work that's being done out there, not just on the side of standards and guidelines, but perhaps also, more among professional bodies and communities. I've also noticed that there's this appetite for more, not just discussion, but action on inclusion. Whether that's in professional associations of humanitarians, like the International Associations for Professionals in Humanitarian Assistance and Protection. Also, I think within the evaluation community, we see a lot. And then there's some very positive trends like data feminism and indigenous knowledge, especially when as applied to like systems thinking and complexity thinking. despite all of these, very positive developments, what I've noticed in my work is that most often people still equate the word inclusion with either disability inclusive or gender inclusive approaches to programming. And I mean, considering these groups is an incredibly important part of being inclusive, right? And I would definitely say that targeted interventions for persons with disabilities, for women, and for other, historically disadvantaged groups continue to be absolutely necessary in most contexts, right, to overcome these long-standing forms of inequality and disadvantage. But having that targeted focus, it's not the same as mainstreaming inclusion from an intersectional perspective throughout the MEL cycle. So I think that, there's still a little bit of a disconnect between the way in which we think about inclusion and, the stated interest in inclusive M&E and actually moving towards that meaningful representation. In terms of what's impeding progress, I would say, despite that interest, perhaps it's just not a collective priority yet. There's no sort of collective will that translates into funding and human resources, or, and capacity for more inclusive MEL. As Sarah mentioned, it's not an easy thing to do. It's very, resource and cost intensive, and in a lot of contexts, there just isn't the time. But I think in order to address those problems, there needs to be some kind of a collective will, right? A shift in mindset, perhaps, within the M&E ecosystem, like funders and commissioners of evaluations, for instance, organizations, as well as M&E practitioners themselves. I think for me, thinking about true inclusion goes hand in hand with meaningful representation and ultimately participation. I hope that answers your question.
Thank you. I actually was taking notes, and I do want to circle back. I think this is going to flow into the last point that you touched upon about how to make this a collective priority and will. And I think we will sort of move on to Mehjabeen for now, but we will bring you back on that one particular very, very important point. So Mehjabeen, sorry, I hope you can, all right. So Mehjabeen, it's your turn. Mehjabeen, you specialize in complex mixed method studies. You are interested in how evidence can contribute to programmatic learning, especially in primary education and health service delivery. And, during our discussion, I mean, we have discussed a little bit about, how your research experience, how you have been thinking about a more inclusive data system, how you have been thinking across the entire value chain a little more systematically. So I thought, I will put in what I think first and then ask you the question. When I think about a more inclusive data system, I believe that for this agenda, like very similar to what Naomi said, at a much larger level, but at a very, very specific level of the data value chain. For this agenda, I think the various elements of the data value chain need to come together in an iterative way rather than a linear progression as compared to, different people working on different pieces. So the cohesiveness of that approach sort of, in my mind, impedes a lot of the good work that can be done on intersection and how we can improve the data value chain. So as a researcher who has been thinking and working on improving inclusion across the value chain, how do you think measurement systems as well as management and practices need to change in order to rise up to the challenge of more inclusive MEL systems? I know this is like a fairly big, heavy two-part question for you, but take your time to answer that. Yeah.
Thank you, Tithee, and thank you, Naomi and Sarah, as well for sharing your view. I feel like we are all sort of talking about the same thing and thinking about the same thing. I did put some slides together, so I hope it's okay to share my screen with you as I talk through both of your questions, Tithee. Shout if you can't see it.
We can see it.
Okay, so I started off thinking, why isn't MEL inclusive? So why are most of our systems not inclusive? And I think the answer lies in who is doing the including and who is not included in the system. So for example, who is it that's developing monitoring frameworks and actually doing the monitoring? Who is it that's being evaluated? Where do these teams sit? Where does the thinking sit? Who does the analysis and who does the data collection, and who is the respondent or the beneficiary? A pet peeve, that word, which I hate using. And then finally, who is doing the learning? So where do these, who develops these agendas and who is the learning for? So when we develop any of this data, finally, are we the beneficiaries of this data, and who is being left out of this process? And I think a part of this is sort of acknowledging that we sit at this table and we invite other people into this space. And by doing that, we end up being gatekeepers of a process, in that we design MEL frameworks, and then we take, which can be quite an extractive process, we collect data or information and use it for someone who may not be the final beneficiary of this process. And thinking about sort of how we have been doing it so far and reflecting on my own work, I think we have, especially with large quantitative surveys or big mixed method surveys, quite sort of a well-oiled process. It works like a really well-functioning machine. We have a MEL log frame and indicators against it. Sometimes in adaptive programs or where there is a crisis, we don't even know the end of what we want to be studying, but we've already sort of put up questions against a log frame. We have a fixed budget for data collection, and we kind of fix the times. Oftentimes when we're doing RCTs, this may mean 3 years down the line, we know exactly when we need to be in the village or the community we're collecting data from. And we have day-to-day data collection plans, right? So we know that our research teams and us, we'll arrive at the village at 7 o'clock, and we need to drive out from there at 6 p.m. And within this small time frame, we will be collecting data. And I think it's a bit like our research processes are a bit like a complex Rubik's Cube that we've learned how to get right every time. So it's like there are all of these moving parts, and we really quickly put everything together and sort of send it out, collect this data, and come back with it for analysis. And the challenge with that is that in this efficient process, we've sort of left, we can, or we do tend to leave out some of the complex issues that sort of sit above MEL. It sits at a system level and a thinking, and like how we think about the system. In part, when we are designing research studies, we don't, including participatory ones, and I, specialize in qualitative research, so we often design participatory research. But the participation comes at the level where we've already designed the overarching sort of agenda for the monitoring, evaluation, and learning plan. And the participation comes at the level of where you're asking people what they think about a process, rather than them participating in setting the agenda for the monitoring and evaluation, right? Similarly with learning, the learning sort of sits at a programmatic level rather than it being quite a democratic process. And one of the reasons why we do this is because we have to respond to sort of fixed timelines and fixed budgets. And that's not really something we can do away with entirely, although that would be lovely. It's what perhaps is a solution is working through where can we sort of democratize or sort of work away from our business as usual models. And then thinking a little bit about what inclusive MEL would look like. And I don't have, as you'll see, I don't have any answers, but like perhaps questions we can ask ourselves to get closer to these answers, which is, will the people who are sort of participating in the monitoring and evaluation have a final stake in the outcome? Is accountability working both ways in an evaluation process? Or are we holding certain people accountable to receiving or doing something, but the accountability doesn't go backwards? So, sort of closing the loop, like Sarah said. And then who is doing the learning, right? So what would a democratic learning process look like? What would it mean for everyone to be able to put what they want from the agenda on the table? And how would that change the way we design our evaluation and monitoring? Would this mean collecting data that we don't usually collect? Would it mean collecting data from people who we may not necessarily meet in an ordinary day when we're collecting the data? And also who are the people collecting the data, and how does that affect the learning process, right? So speaking a little bit to both Naomi and Sarah's point about having the right people on the team at the right time to be able to do this process is extremely important. And in part, we are not the best judge of that, or we won't be until we've actually opened up this process to feedback. And all of this affects the way we set an agenda. And I think learning is at the heart of this. This is something that I've been really interested in over the last few years, and we've sort of been doing at OPM, which is the minute you open up the learning agenda and you ask, right, what is it that you want to learn from this? What data you collect and how you collect it changes completely. And it's very different from saying we need X number of household indicators and X number of consumption indicators to be able to say why. I think it's saying, right, this is important for us, and it is just one of the things that's important. If we really are being inclusive, then these are the other things that are important, and we need to collect this data differently. And putting learning with the big L at the start before M&E sort of allows us to rethink this process a little bit. And I'll just use an example of a study that we did when it was possible to travel, which feels very long ago anyway. But in 2019, we had a research project in Vanuatu, where we were trying to understand why do certain women not use healthcare services. And we realized that the reason, to be able to understand the why. So we had lots of public expenditure tracking information. We had quantitative survey that had been done by organizations before us, and also data that we had collected. But we still weren't able to understand the why. And to really understand the why, we realized we hadn't been speaking to the right people. It was a light bulb moment that went off perhaps a few months too late. But when we realized that we had to do a lot of rethinking, going back to the drawing board, rebudgeting and reworking up research plans, but also take a very different approach to data collection altogether. And this was a presentation I had made to convince both internally as well as our research team about why we need to change up the process of how we work, which is you cannot go into a community in the morning or to a health center and then expect the women who wouldn't turn up anyway, wouldn't access the service, to be there as a respondent. And using sort of qualitative research techniques, which are steeped in ethnographic practice, sort of provide us a starting point towards this, right? Which is who are you, how you introduce yourself to the community, your understanding of what a community means, how long you spend there, where have you actually situated yourself in, physically in a village, and how long you are willing to wait for someone to turn up or speak to you changes the kinds of data you collect. And a lot of this meant working outside our comfort zone. So we had a budget that we knew we could not cross the ceiling. But we had we had a research plan which we shared with our team, who our team in country, and we designed our questions every day, and we designed a different plan every day, and each day looked different in this process, and it was really different from our business as usual model, and the data we collected was really different. We would start the day knowing that we wanted to collect X kinds of data and would end up geographically, but also theoretically at a very different point than where we had been the day before. And I think these kinds of research methods come with being able to shift a mindset as well about how you will be doing the research. And it probably helps sort of, collect data that you might otherwise not collect and have a more inclusive agenda and more inclusive data at the end of this process. So I hope that that sort of answered your question.
Excellent. I just have one fairly simple, but this is something that weighs on my mind, and I think every JPAL researcher's mind as we sort of plan the kind of data that we want to collect. I really liked what you said in terms of why we should loiter, and there is value in sort of thinking about this in a slightly different manner. And having worked in a quantitative, having worked with quantitative data pretty much all my career, I just slowly and steadily we are seeing the need for using qualitative data to understand different kinds of underlying mechanisms, to try and understand the world a little more, I would say, meaningfully, as opposed to, as Sarah mentioned right at the beginning, as just looking at spreadsheets and trying to figure out what that spreadsheet means and whether it's truly representing one's agency or one's identity well enough or not. So I have a very, very short question for you. So the largest problem that I feel with, say, for example, long drawn data collection exercises is the burden on the community, right? Already these are marginalized people who have very, very low access to resources. Long surveys or qualitative surveys or different kinds of methods might take up a lot of their, productive hours in a day. So you as a researcher, how do you think about, reducing that burden at the respondent end?
I have sort of the beginnings of an answer, but definitely don't think we've arrived at a solution. I think the first question is, why is this? Why is it time consuming and why is it extractive? And it goes back again to this whole thing of how are we managing our MEL systems, right? How are we managing our data collection? I think we manage it to maximize how much data we will get in a certain time frame and a certain budget, rather than how we're going to maximize other things. For example, ensuring that everyone can participate in the research process, or maximize sort of comfort and the ability for respondents to answer when they are ready. There is not a quick fix for this, right? Some of the things that we have done previously is to use respondent-led data collection, which means that it's not a team that's coming from outside to collect the data, but rather data is collected by peers. Diaries, for example, are a good way of allowing people to respond to your answers at a time when it is convenient for them, which we've used previously and successfully. It does make the entire data collection process and the analysis process extremely complicated, but it also means that you need to work really closely with the people you're collecting data from to interpret what the data is, right? So if you've not been part of the process, then you definitely will not understand everything that you've collected. So you need to make that process more inclusive. And I think certain methods are just better suited to collecting this data. I want Professor to have an answer for what this might mean for quantitative data. I do think that mixed method studies, speak to the strengths of being able to be flexible and in fairly inflexible scenarios. But there's a lot of other things that I think we can learn, which some of it is just the ability to be reflexive and empathetic, and the ability to plan for unknowns, right? And oftentimes I feel like our data collection process is actually really, it's really tedious and demanding of the people who are collecting the data as well, not just the people who are responding to the questions. And just having a bit of room or space to maneuver makes the entire process a little bit more humane. And it does come with this idea that we need to fund it, right? Like we'll have to put money where the plans are, rather than the other way around.
Excellent. Thank you. Thank you so much for that, Mehjabeen. Sarah, I'm going to come to you because, hearing you speak, Mehjabeen and Naomi, all of you speak, I think one key thing that is coming to my mind is just context. There are certain things that we can aim to sort of standardize, certain things where context absolutely drives. The example that you gave about the pregnant woman who was not pregnant the last time round or is pregnant this time round. So her conditions and her entire approach to how she is going to be looking at any sort of problems that are in front of her are completely going to change from one year to the other. So I think my experience hasn't been that sort of granular in terms of why context matters, but I think I can think of, like, say, two things that are at top of my mind before I jump onto this question for you. Is that a lot of our JPAL researchers have been working in places where they highlight the importance of intersectionality. So the reason why I brought up context is from the perspective of India, diversity inclusion is very, very different as compared to, say, for example, the United States, right? Caste is a significant barrier to a lot of, I mean, I wouldn't say just a barrier, but it's correlated with a lot of, sort of slow moving progress outcomes for a number of individuals in the country. And one research that comes to mind is this interesting intervention that one of our researchers had thought of is thinking about games and sports that could drive cooperation across castes, so that there is a way in which communities can come together and sort of be more aligned and drive different kinds of outcomes. And it was extremely successful because we used cricket and we used it to see if that could improve cooperation across castes, and we saw positive significant and positive results driving that intervention forward. Similarly, there has been very recently one of our other researchers, Leigh Allen, who has been a panelist also in the past, but has been working on how we can teach students perspective taking to improve social cohesion in Turkey. And when I think about, like, say, these two diverse contexts, but trying to look at, say, social cohesion, and while the broader theme is very similar, the context and the intervention and the approaches are very, very different across these two. So in your experience, because you've worked in, like, say, Philippines and Bangladesh, two very, very different extremes, but if you could think about, like, like, there could be certain areas where, or certain contexts in which the need for looking at intersections and looking at inclusion is becoming extremely pertinent at this point in time. And after that, I'm going to hand it over to Naomi to talk a little bit more and drive that home, that point home. But yeah, over to you, Sarah.
Thank you. Yeah, I mean, I think probably across all of the work that we do, looking at gender and intersectionality is super important. I think for me, where I would put the emphasis, so all of our work is on climate risk in the work of my team. So it's all in places which are acutely vulnerable to floods, droughts and heat waves, are the ones that we work on the most. And if I could choose where to put the emphasis, I mean, there are some countries where we work where we haven't been there for that long, and the humanitarian, and also there hasn't been that much work on those hazards. So, for example, we've been working quite a lot on heat waves in Pakistan over the past couple of years now. Obviously, it's like super hot and there are heat waves all the time, and we've found that there are significant differences in the way that men and women access and interpret heat information, and in their likelihood to share that information onwards. And there's a whole thing about, like, literacy there as well. So I think that's one specific programmatic area. But generally, I think that the whole area of addressing climate risk, like, as a kind of thematic area, which is pertinent across so much of the SDG agenda, like across we're only going to see more extreme weather. And I think that if we can now, whilst there's a lot of engagement in this kind of agenda of trying to better use forecasting and risk analysis to address climate risk, I think that now, whilst this agenda has a lot of momentum, I think that there's like a really good opportunity to push new methodologies for inclusion that can potentially work like across hazards and contexts.
Got it. Thank you. Thank you. That was super interesting. So Naomi, I'm going to pass it over to you. You have been, passionate about the use of empowering others to use M&E towards greater inclusion and participation. You have worked across UN agencies, international NGOs, across different geographies, so Sub-Saharan Africa, East Asia, Europe, on diverse topics such as, decent work, child labor, and you have done cross-cutting themes like gender mainstreaming, youth employment, and disability. So while, when you were listening to Mehjabeen speak, we've also discussed a little bit about, the role of mixed methods when we last spoke. But I think what I wanted to draw from Mehjabeen's point as well is, I wanted to take that a step forward with you. So first, I think I would want to ask, how should the MEL community be thinking about more inclusive indicators first? Or, how, so you can think about the role of the indicators as well as, outcomes and how the different aspects of measurement work. But I want to hone in a little bit more on the indicators point. That's the first part. And the second part is exactly the question that I asked Mehjabeen is, how do we ensure that marginalized groups participate and benefit from the data efforts and they are not put at further risk? And I think, again, your experiences might be a little different in terms of how the both of you have been planning it. But if you could, take a step back, take us through, your experience a little bit and then move over to inclusive indicators, that would be great.
Sure, thank you so much. Yeah, so to tell you a little bit about my own sort of M&E journey, and how inclusion has sort of become this overarching theme and goal of my work, right? Perhaps I could just highlight some of the lessons that I have learned about inclusive M&E along the way, and how I communicate about it with my clients and with other members of the M&E community. For instance, I'm working as an independent consultant, but I also have a wonderful opportunity to work as a senior expert and technical advisor with a small consulting firm that's based in the Democratic Republic of the Congo called Expertise Humanitaire et Sociale. It's a firm that focuses on doing studies, evaluations, and assessments, as well as some capacity building. And within our own code of conduct and research standards, inclusion is a very important thing, as are participatory methods. And something that I've noticed is that whenever we talk to clients about this, when we're sort of planning the research, when we're coming up with our inception report, there is always a large amount of interest in inclusion. However, by the end of it, there typically is not enough time or funding to actually undertake some of that more complex data collection and analysis, especially in the environments where we operate, where data collection is quite complex. This is sort of similar to something I've experienced as a monitoring, evaluation, and accountability and learning officer during the refugee response in Southern Europe a few years back. Is that in general, there was a lot of focus on inclusion in programming, right? But not so much in the monitoring and the evaluation aspect of the programs. Generally, there was no baseline information. The data wasn't disaggregated beyond gender. So there was really kind of as a similar experience to, now with Expertise SH, this mismatch between the stated aims and the way of doing things, right? With M&E sort of being this afterthought or seen as being externally imposed or procedural. It's kind of a similar thing that I've seen within UN agencies. In addition to working as a consultant, I've I had a staff position that focused very much on digital inclusion. So we looked a lot at how different categories of vulnerable and marginalized people could be using digital technologies for their own empowerment and socioeconomic inclusion, but that dimension of intersectionality was missing in a lot of project documents. It just wasn't really mainstreamed. Then in terms of, I've had a lot of opportunity to do capacity building work, including with Activity Info, which is a M&E software for humanitarian and development practitioners, and with P2P, which stands for Peer-to-Peer Career Advisory Sessions for Young and Emerging Evaluators, which is kind of a network supporting young and emerging evaluators with advisory sessions, training, and other resources. And the point that I want to make with all of this is that there is a very strong interest, I feel, among M&E practitioners. But at the same time, they feel pressure for delivering on inclusion or participation without really knowing how or being given the resources to do it. And one of the opportunities that I've had is to sort of work on that technical capacity building among the M&E community for inclusive M&E. So I'm very happy with that second question about the inclusive indicators, because this is something, that comes up quite a lot. So just to recap your question, you asked how should the MEL community be thinking about more inclusive indicators? Exactly. So I would highlight two things here. Truly inclusive indicators, right, just to take a step back, are those that reflect different groups of people and their particular needs, and which are also, as much as possible sensitive to intersectional identities. And inclusive indicators can actually be used as tools to set inclusion targets and to keep ourselves accountable to our own inclusion goals. So the way that I like to explain this is that there's many different kinds of indicators, but they can all be used for inclusion purposes in one sense or another. So if you'll allow me, I'll just share my screen to sort of clarify what I'm getting at here. Can you see that all right? Yeah, perfect.
Yes, we can.
Yeah, so I like to think about indicators in terms of person-related and non-person-related indicators. So the person-related results or performance indicators, they're the ones that reflect intended changes among people, right? So individuals, households, communities, societies. And these are usually the ones that people think of when we're talking about inclusive indicators, right? Because usually we're talking about social inclusion. So these can be further broken down into three general types. There's differentiated indicators that we can use to monitor whether changes are the same for different groups. Right? So an example of this would be an indicator that differentiates between women or men, or is subdivided into age cohorts, for example. Specific indicators are used if we are targeting a specific group in our intervention. So like I was talking about earlier, those very targeted programs, for example, to measure change for women only, or rather than for women and men, or for persons with disabilities only. Then there's also neutral indicators, which I feel are often kind of ones that people forget about in the whole conversation about inclusion, because they're not really the type that you would disaggregate according to personal characteristics. Right? Neutral indicators are appropriate in cases where having a certain identity is not actually relevant to the changes that are being observed. So for example, you can have an indicator like all health advisors acquire knowledge about ethical standards of care for persons with disabilities, which is obviously a very important sort of feature of inclusion, perhaps in a particular program. But it doesn't actually matter whether the health advisors themselves in the indicator have disabilities or not. Then the second sort of big type of indicators are non-person related indicators. And these reflect changes which are not measured in relation to people, but rather the context in which they live and how it can influence their inclusion or exclusion or, you know, discrimination, vulnerability. So these could be things like laws, regulations, policies, services, and products, right? Even different aspects of the physical environment. An example of an inclusive non-person related indicator could be something like for a disaster risk reduction project. You could say disaster risk information and assessments are accessible, understandable, and usable for all communities in a geographic area. And assuming that you've done a very good needs assessment and you're aware of who is living in the environment of your project, that could include, for example, a certain indigenous community or persons with disabilities. I would say, and this is sort of picking up a little bit on a point that Mehjabeen made, and also an earlier question that you asked, Tithee, about kind of that connect, right, between quantitative and qualitative. I would say that actually one of the best ways to formulate indicators that are useful for inclusion is to combine both quantitative and qualitative indicators within the same results framework. Right? So this would allow you to focus on the substance and the quality of the results and define specific criteria for what constitute each in the context of your project. So as an example, I've worked on some projects that have a very big capacity building component. And quite often you'll see an indicator like female to male ratio. And the thing is, even if you find that the course had a high rate of women participating, this doesn't actually tell you whether women and men equally benefited from it, right? So to better understand the actual impact of the training, you would also have to ask questions like, was the training content relevant to both men and women, or did participating in the training produce equally positive results for both? So in other words, equal participation may be necessary for gender equality, but it's not sufficient by itself. And a good set of indicators will be aware of this and will sort of complement each other and, you know, kind of cover both of those types of questions. Finally, something that I think is very important is the fact that we can actually use indicators to set internal inclusion targets for ourselves and to keep ourselves accountable for those goals. So I've just been talking about, you know, the person-related and non-person related results and performance indicators. Output indicators can also be extremely useful because they can be used to monitor the quality and participation, you know, which are both very important aspects of inclusion within a project, even though from the example that we just saw, obviously it's not everything. In terms of accountability as well, input level indicators can be very useful because they can give us very important clues about whether a stated commitment to inclusion is actually being followed through on by investing human and financial resources. Of course, I mean, at the end of the day, we have to find a balance, right, between the mandatory indicators, so those that are specified by funders or commissioners, sector-specific standard indicators, as well as our own project-specific indicators. And there's the added challenge that obviously we don't want to have too many, because then you run into the problem that Mehjabeen described of, you know, overburdening people with the data collection. So it requires really a lot of thought. However, I think that if we keep in mind that, you know, first, different kinds of indicators exist and they can all be used for inclusion somehow. Two, combining qualitative and quantitative indicators is the best for the purposes of inclusion. And three, that we can actually use indicators to for target setting and for accountability purpose. I think that we're well on our way as a MEL community to thinking about how indicators can be useful for inclusion. I think you had a third question for me, which I've forgotten.
I had a follow-up question, but I think, I mean, I'm happy to circle back to it later, but I think if you had any sort of like, you know, just to tie all of this together, like after, you know, exactly how you spoke about qualitative and quantitative data, you spoke in depth about indicators, and thank you so much. It helped us understand this really, really well, I think. But going back to the question that I had for Mehjabeen as well, and this is something that you and I have discussed even before the discussion, is how should we ensure marginalized groups participate and benefit from the data efforts, and that they are not put at further risk. So I think the first part, I mean, everything that you've spoken about, your experience in terms of participatory research and systems, I think that sort of speaks to that. But, how are we going about thinking about the do no harm fundamental principle towards, research in general?
Sure. If I could actually just circle back to that participation question really quick, because I had a lot of things going through my mind as Mehjabeen was talking, which I found really fascinating, and which I've done some thinking about as well. So I wanted to share this slide with you, which describes what I think is for me anyway, a very useful way of thinking about participation and inclusion. Right, because I feel like just as inclusion, participation is kind of thrown around as a term a lot, but we don't actually really know exactly what it means in practice. And I think that if we understand participation as being on a continuum, that can sort of help to clarify what exactly is being meant, and whether communities are actually being meaningfully represented. So, and I think a lot of that actually depends on the aims of our MEL processes themselves, right? So the agenda there, which I think can sort of range from functional to transformative. Functional being M&E processes that, for example, seek to produce new knowledge in a particular field or about the performance of a particular intervention according to an agenda that is driven by the practitioner. And on the other side of the continuum, we have transformative aims, where M&E processes themselves and the knowledge that we produce through them are used for the purpose of action and change as defined and driven by the community. And so if we look at these levels of participation on the functional end of the spectrum, the practitioner informs or consults with the community, which is, to me, participation in name only, and it can be very tokenistic, right? Sometimes organizations use this form of participation to legitimize a particular finding or a decision, even if there's no real sort of co-leadership over the M&E process or joint ownership over results. On the other end of the scale, towards the more transformative aim of the M&E process, we see a really meaningful collaboration between the practitioner and community that includes shared decision-making and leadership, or even the empowerment of communities to lead the M&E process themselves and act on its results. So I think taking this, we can think of a lot of different ways that participation can be used within the M&E system and throughout the M&E cycle to actually make it more inclusive. And I won't go through every single step, but perhaps just linking back to the inclusive indicators, right? Communities can be involved in deciding how progress should be defined and measured. And actually it has a lot of benefits for the interventions themselves and for our own M&E processes, right? Because if you collaboratively choose indicators and metrics, it can make the intervention much more realistic, culturally relevant, and responsive in its aims. I'll stop sharing my screen and perhaps just a couple of words about doing no harm, if you allow. Is there still time?
Yes, a couple of minutes.
A couple of minutes. All right. Well, I guess what I wanted to say about this, the methodological and practical choices that we make about our M&E processes are also ethical choices, right? And these sort of ethical choices, they crop up all throughout the M&E cycle. But if we zero in on data collection in particular and the principle of doing no harm, it means that when we decide what data to collect, we should always assess the potential risks for respondents or informants. So typically the kinds of questions that you should be asking yourselves is it absolutely necessary and appropriate to collect this data? Will it be used for the benefit of the groups it describes and society as a whole? Can it be kept safe? And is there a risk that it will create or reinforce existing discrimination, bias, or stereotypes? Because these are all things, the risks that are inherent in the types of data that we collect, which I amplified by a few risks that actually occur during the data collection itself, and methods really need to be adapted to the context, right? So methods for development context are perhaps not appropriate for humanitarian contexts. They need to be adapted to the people that you speak to, and the principle of doing no harm. It should also apply to those collecting the data as well, right? Because in a lot of situations, the enumerators can be put in harm's way through the data collection exercise. So just a very brief way to say that we need to have a very holistic and thorough kind of thinking about the ethical choices that we make and the principle of doing no harm. But I'll leave it at that.
Thank you. I could see both Sarah, Mehjabeen, myself like nodding along, absolutely agreeing with the last points that you had to make. I think it resonates very strongly across the different kind of work that we sort of do, but the aim of bringing all of that together in a safe environment, both for, I would say, enumerators as well as the respondents. I think it's super, super useful. So I think with that, I'm going to start pretty much on the last or semi-final section of this discussion. So I'll move over to Mehjabeen. So Mehjabeen, I mean, and Sarah, next I'll come back to you on pretty much the same question. So, Naomi has been talking about, her experience in terms of working with different stakeholders. She did highlight right at the beginning and, throughout her conversation, the need for a collective will. While we do see that there is a lot of discussion about, saying that we are committed towards certain kinds of goals and how the approaches that we are taking are pretty much not in line with each other. So, Mehjabeen, my larger question to you is when we are thinking about designing more inclusive MEL systems, are just, measurement data, efficiency and results, when we look at it in a piecemeal manner, like Sarah mentioned, are they going to lead to an oversimplification of what is already a very, very complex future-ready agenda?
Thanks, Tithee. I feel like this is a really complex question to answer, but I'm going to take a quick stab, which is, I think that we have to, at some level, simplify the process. So just to play devil's advocate, within any sort of monitoring, evaluation, and learning process, we need to be able to really drill down to what is it exactly that we need to collect and how we collect. So that sort of has to be really clear and not simplistic, but it needs to be sort of simple. Otherwise, we end up sort of collecting more data than we need. We end up, with more information than we ever use, and that sort of hasn't ever been helpful. But what we end up doing is simplifying a fairly complicated process or a complex process, and that is sort of truly being inclusive will not be simple, right? So that that it won't always be financially or like resource efficient in the way we have been thinking about efficiency. And it's just being able to rethink what we mean by an efficient process. So something that might be financially efficient may not necessarily be most efficient in terms of achieving the impact we want, nor will it be most efficient at our agenda if our agenda is being inclusive. And I think being able to rethink that would perhaps bring us closer to where we want to be. And then just going back to what Naomi was saying, which is being quite clear with ourselves where on the scale we lie that she showed us, which is there a fairly straightforward functional process, or are we expecting more, and where on the scale do we lie in this process will help us determine what the appropriate methods are that we need to use for MEL. And then again, also like who is learning and what they're learning for, again, on that scale, which I thought was really helpful, Naomi, will help us sort of also explore what method it is. And that's where it starts becoming complicated again, right? Because then there's a whole toolbox, and then sort of a survey might just not be enough, or a few conversations won't be enough. And then you need to go back to the toolbox and pick the most appropriate process. Thank you.
Excellent. Thank you. Thank you. Sarah, I think the final question that I have for you is, again, a very, deceivingly simplistic question, but, feel free to approach it however you feel like. But, how do we go about thinking about this collective will from your perspective? How do you think would be the most efficient way or the most impactful way of engaging with the different kind of stakeholders who have completely different incentives to forge an alignment towards, truly inclusive MEL agenda?
Yeah, it's a great question to end on. And it's something that I think about a lot in my work, because I sort of work with different country teams and sometimes on quite short projects. I think that there's probably two things, perhaps maybe quite basic points, but one of them is around trying to demystify the whole monitoring and evaluation process. I feel like people who aren't M&E specialists can find it quite boggling, and talking about kind of logic and detailed theories of change and linking that to indicators. I see it putting people's heads in a spin all over the place, and I think to have inclusive systems, we really need to take the sort of we need to take the time to demystify that whole process and make sure that everyone in the room has like a base level of understanding of exactly like what a good M&E system looks like. And then I think the second thing that I would say, especially sort of coming from a position where, I'm based in London and I work with different teams all over the place, is really spending more time listening than talking. Obviously, it sounds silly now that I'm sitting on a panel saying that, talking, but we have so much to learn from the teams that we work with and from the people who collect the data. I feel like enumerators are often sort of treated a bit like in a very transactional way, when they get so much more nuance than what might come through on an interview script or in a spreadsheet or whatever it is. And so I think, yeah, like really spending time listening to different people's perceptions of what the success of a project might be, and then with enumerators to try to like get their real reflections on what they think the data means, and working with people at that level to interpret information. I think all of those kind of foundational bits all kind of pave the way towards a good inclusive M&E system. And then the final bit, I think, is that I often see evaluations take place and there is a kind of hypothesis, or like we know roughly what change we're at least measuring, but when you ask people what change you're actually expecting to see, like people might be interested in looking at nutrition, but how much are you expecting people's nutritional outcomes to improve, or are you expecting it to stay the same when a shock has happened, and how are you expecting that to be different for people in different groups? I think that being a bit more concrete about what exactly we're expecting to see in communities and how we think that that might differ between groups, or people with different kind of characteristics is another really helpful conversation starter to have, to start building these systems in a more inclusive way.
Excellent. So I did want to leave about 10 minutes for Q&A, but Naomi, Mehjabeen, any quick thoughts on the same question in terms of how should we think about bringing together different kinds of stakeholders in this particular system towards the same goal? And I'm going to start reviewing the questions. So participants, please feel free to add in any questions that you would want to ask the team, the panelists, and I'm happy to read them out.
Should I start?
Sure.
Thanks. Yeah, so I think, we've all sort of come to the conclusion here that inclusive MEL really requires an enabling, like a set of enabling conditions, I think both at the system, organizational, and individual levels, right? So there's a lot of things that need to happen on all of those fronts in order for there to be, this collective sort of will or response or movement on inclusion that I was talking about in the beginning. And very briefly, I'd say for funders and commissioners, the most important thing would be to actually integrate inclusion into terms of reference, for example, through mandatory indicators that are inclusive, or integrating inclusion into key evaluation questions, also setting a realistic budget, right? I think many evaluators and field researchers already feel the challenge of being asked to do good research with a small budget. And if we're doing varying, if we're prioritizing inclusion, then we need a very granular sort of look at things. I think with organizations, we need to mainstream inclusion into operations, our approach to programming. There needs to be dedicated human and financial resources. We need to make sure that there is capacity for inclusive M&E, and perhaps also not asking M&E people to do everything at once, right? Make sure that there's a gender expert, make sure that there's a disability expert, make sure that there's an organizational culture where all these people can sort of talk to each other. And finally, I think for M&E practitioners, we need to recognize that we actually have a lot of power and responsibility, right? Because we can decide what counts as progress and what counts as impact. We're usually in a very privileged position to speak directly and directly involve communities in M&E. So we can really steer the direction of an intervention through the evidence that we present. And I think that, we have a big responsibility, I think, to advocate for more inclusion, both with our clients, the organizations that we work for, and with our peers. Back to you.
Excellent. Thank you. Thank you so much, Naomi. Mehjabeen, any thoughts?
Yeah, really quickly. So I think in addition to the stakeholders thinking about the different elements of the process, so the first is how you're choosing to spend your dollar on what, and how that, which includes how do you staff your team, how do you plan your research, how do you plan evidence use. The second is how is data collected and communicated. We often end up with 200-page reports that are almost always in English, and that's sort of extremely a very undemocratic way of sharing, like assuming that everybody's going to be on top of reading, a 150-page report with regressions, and then another 50 pages of like chunky text already excludes how people are going to use and learn from this data. And I think finally, the onus is sort of how on learning, which is what is going to happen with this data and who owns this data once it's collected. So once the data is generated, it's sort of oftentimes sits there for someone to make good of it. And that onus needs to be on us to ensure that whatever data is generated is being used by everyone who is part of the entire process, from planning to sharing the data.
I think excellent. That was an excellent point to actually end on. I was looking at the chat window. Unless I am wrong, Pranati, I actually don't see questions. So I think I want to believe that we've given our audience a lot to think about. And what I'm going to do is I'm just going to hand it back to Pranati in a minute. But Pranati, can you confirm? Am I looking at the questions?
There's one question from Maria.
Yes. There's one question from Maria, Tithee, which says, how do you make sure that interviews from different backgrounds, genders and educational levels understand questions well and feel comfortable saying if they don't? Is there specific training for enumerators, etc.? So if the panelists feel that they want to maybe add something onto this question, that would be wonderful to know.
So Mehjabeen, Naomi, Sarah, anyone would want to attempt that?
Go first. So I think there is definitely training that can sort of help. It depends on what research you're doing. So if it's a quantitative script, a lot of this gets scripted right into CAPI, and then you sort of train your researchers on prompts. But a lot of this sort of being able to actually strike a rapport comes before even you approach the respondents. And I think this is it, sort of spending a little bit of time with the person you're going to be collecting data to be able to then read out your script is important. With qualitative research, I think there's a little bit more room to develop that rapport before you start and understand where you're going. Oftentimes it's just picking the team. So if you pick a team that is based just to give you an example, that's based in Bombay, but doing research in Maharashtra, it's going like the results you're going to get are quite different just because of the way you present yourself when you talk. And I think it's that ability to be reflexive, which can be taught. There are a huge amount of resources online, which I'd be happy to share via JPAL, which like talk about how can you be more reflexive and sort of also sort of aware of your own position in the research process.
Thank you, Mehjabeen. I personally would be looking forward to those resources, but Naomi, you had your hand up. Yeah.
Thanks. Yeah, just very briefly, just to add to Mehjabeen's response, I would say that for both quantitative and qualitative questionnaires, just to go back to this idea of participation and how participation can benefit the M&E process. If you actually have people from the local community participating in putting together data collection tools, they can actually give you a very good sense of how certain questions should be phrased. I think especially when it comes to very sensitive or taboo topics, they'll know exactly how to address certain questions within the community, or address them in such a way that people would feel more comfortable talking about it. I would also say that testing and retesting your data collection tools is extremely important, just to make sure that you've got the nuance right. And even after you've collected the data, especially if you're going for nuanced responses, I think it's important that, as much as possible, you involve the people who have that local kind of social and cultural knowledge in order to correctly interpret what people have told you.
Excellent. That totally resonates with my experience as well. But Sarah, you should go next. Yeah.
Yeah, what I was going to say is actually just exactly what Naomi ended on. I think it's all about carefully choosing your interviewers so that they can have like proper conversations with the people that they're interviewing, that they understand the issues and that they don't need all of the context. And another thing that we did when we did the Missing Voices exercise was to co-develop the interview tools with the people who were collecting the data rather than like give them a script. We sat together and created the tools, and I think that really helped in their ability to then like confidently go ahead and know exactly what we were trying to pinpoint.
Excellent. I'm hoping, Pranati, there are no other questions, because we are exactly at time. So before I hand it back to you, can I very quickly thank the panelists? So Naomi, Sarah, Mehjabeen, thank you so much for being so generous with your time, taking the time to talk to me in advance, and for these amazing thoughts. I will be looking forward to any emails that you have to send to me, and with respect to any resources that you think this community should be looking at, anything that's of interest, and we are more than happy to pass it along to Pranati and her team to make sure that all of your learnings reach the larger M&E ecosystem. And yeah, thank you so much, and let's keep in touch. Pranati, over to you.
Thanks, Tithee. A huge thank you to all the panelists for joining in today, and as well as all our attendees for being just so great and being here throughout, listening to this enriching conversation. And thank you, Tithee, for moderating it so well, for being so supportive throughout this entire process. In fact, since this is our last session in collaboration with JPAL, I'd also like to extend a very, very warm thank you note to the entire team at JPAL, which has been so cooperative and so supportive of this initiative. And we do look forward to keeping in touch with all of you. And Tithee, I'll be looking forward to your meeting alongside with all of our panelists to just, exchange resources to keep these conversations going forward, and to perhaps, build something that we're imagining together. That would be lovely. I won't keep everyone for much longer. I just have 2 quick announcements to make. This has been a great panel, and we'll be following this up in half an hour. At 7:30, we have another panel going on the same link, which is on track 1. titled When Inclusive Processes Fail, Lessons Learned and Limitations of Structural Measures in Inclusion. So I feel like it will be a great reflective exercise for all of us to collectively undertake. We look forward to seeing all of you there at 7:30. We also have great sessions lined up for Monday and Tuesday, which will be the last 2 days of the UnConference. So we're super excited to be, having a whole host of sessions with Breakthrough India, Dalberg, and Dalberg Designs. And we really look forward to having you all there with us as well. Another quick announcement that I wanted to make on behalf of Belong is regarding the kind of conversations that we've been happening, that we've been kind of trying to anchor through the UnConference as well, which is about diversity and inclusion, especially for South Asian audiences. And we're very happy to share that Belong has now launched a short format literary content mobile app, which focuses on very similar conversations, very similar literature pieces. And we have, high quality book summaries, interviews, local readings, with content on feminism, gender, sexuality, race, caste, etc. And we look forward to all of you taking a look at that as well, giving us your feedback and just interacting with it in general. It's spelled another, UNOTHER, and I'll be dropping the link for that in the bio as well. So thank you, everyone. I'll be sharing like I said, our schedule for the coming days, and we look forward to seeing you in half an hour. Have a great day ahead.